Hi, welcome back. Here today we are going to discuss about some important topic where the NCLEX loves to test. Yes, it is about the advanced directives and DNR in NCLEX context. The one DNR myth where the NCLEX loves to test is exactly what we are going to see in today's topic. Okay, let's go into the topic. We are going to dive into what are advanced directives. These advanced directives are a legal document which are stating the patient wishes if they cannot speak for themselves. You see the types. A living will. It is what care you are wanting or what is not wanting. It is a legal document that allows you to record what are your preferences in the for the future medical treatment in case you are unable to express by yourself. And next one is the healthcare proxy. Healthcare proxy is who decides. Here, this is a given set of person or a person whom you're giving the authority to take the medical decisions if you're not in a state to give your own decisions. So this is healthcare proxy. And last one is the DNR or the and DNI. DNR is do not resuscitate and DNI is no intubation, do not intubate. Okay. So the main NCLEX rule here is we have to follow the advanced directives only when the patient lacks capacity. If the patient in his senses, then we are not going to follow his advanced directory. If he is not in his senses and he lacks the capacity, then we are going to follow this advanced directory. The top DNR NCLEX myth is they are being always a trap when we are answering the NCLEX type of questions. Here, the myth one, it is DNR is equal to no treatment. DNR is no treatment. This is always a myth. And the truth about is this, DNR means no CPR only. Means DNR means we are not going to give CPR only. It doesn't mean that we are not going to give oxygen, IV fluids, antibiotics, pain medications, comfort care. All these things have to be provided. If DNR is saying, means we are not only going to perform the CPR and rest of the things we are going to provide. And the NCLEX tip here is DNR patients still receive full nursing care. Yes, you heard it right. They will receive the fullest nursing care. Next myth is what we are going to see is family can override DNR. The truth is family cannot override the valid DNR, right? Who wins? It is always the patient wishes, what he wishes, and what are the legal documents, what he has said priorly, and who is the healthcare proxy he has assigned. Only they can decide. No family opinion comes in this picture. Next DNR myth is DNR means let them die. No, this is not correct. The truth is DNR, we are not going to neglect the patient. Means we are just going to withhold the CPR. And we are not going to withhold any type of care which is being provided to the patient. So we are going to provide all the essential care for the patient. So here, if you fail to treat, in case of thinking the DNR, it is a great negligence from our part. So we have to see this particular thing when the question asks this. Next, the myth number 4 is nurses can ignore DNR in emergency. No. The truth is valid DNR must be honored by the nurses and all the medical professionals even during cardiac arrest. So if unsecure, if there is no valid DNR, you can start CPR until there is a DNR is verified, right? Next myth is advanced directives apply only when the patient is awake. No, this is a myth. The truth is if the patient is alert and competent, they can decide and they can say no. Here we are going to dive into an extreme, that is NCLEX SATA type of question in the context of DNR. The question goes, the nurse is caring for the client with a valid DNR order. Which actions are appropriate? So select all that apply. The options here are administer oxygen for dyspnea, provide morphine for pain, start IV fluids for dehydration, initiate CPR during cardiac arrest, withhold antibiotics for infection. And the right answer here is yes, it is 1, 2, and 3, where 1 states administer oxygen for dyspnea. Yes, we can give the oxygen therapy and provide morphine for pain. Yes, pain relief can be provided and start IV fluids in case of dehydration. Yes, this is also correct. But what is not correct is we are not allowed to do CPR if it's a valid DNR order is already been provided. And treatment should be given. There is no the DNR doesn't say that we cannot provide treatment. We should provide treatment, and but we are not only which we are not going to provide as the CPR, right? And the next scenario I'm going to take you through is an 82-year-old client with a valid DNR becomes unresponsive and pulselessness. So, what is the priority action? Here, the priority action is do not initiate CPR. The next nursing action, what we have to focus is we have to notify the provider if such patients we are getting and provide the comfort care, what type of care we need to provide in our recommendations, and support family in such bereaving the family by providing them emotional support, and we should document the finding what exactly is happening to the patients. So what is wrong is we should not initiate a CPR or we should give the chest compressions. We should not wait for the family permission, right? Because already the DNR order has been provided. So we are not going to take consideration of the family's permission. So in total, what is the one thing that we should always remember is DNR does not mean do nothing. And here is the NCLEX which always loves. Students always fall into the trap. So we should always obsolete this by DNR means no CPR. That's it. It is just as simple as it. And oxygen we are going to provide. Yes, of course. Pain medication again we are going to provide. Antibiotic therapy we are going to provide. The only chest compression and defibrillations are withheld. Yes, if you remember this, you can avoid and guarantee your NCLEX fail. Okay. I now hope this topic on advanced directory and DNR is clear to you all. If you would like more such contents, please do comment and subscribe. Thank you. Happy learning.